there's a lot of cool stuff I can show you with my ultrasound machine, specifically heart disease. What I do is I put gel on the probe, and I can look at my anatomy. Right there. And that's me. That's my artery. And it's just like that, how it's seen on the screen. Now with this machine, ultrasound, I can see the lining of the artery, this very thin pink area. It's live, it breathes, it's very sensitive, and it exchanges nitric oxide with the blood. So when you go exercising, that released, this is the membrane that tells your vessel to get bigger. And when it's compromised, when it's thick, when it's inflammation, the heart has to work harder to push blood through the artery. Also, if your cholesterol were bad, it comes down this artery, and then it spins because it doesn't split evenly between the two. There's a little turbulence, and that spinning blood is the perfect place for that bad cholesterol, that bad LDL, to get pushed into the wall. And if that happens a lot, you get plaques. And I can see that on my own artery. I can see one beginning right there. This machine is very powerful, and what I do is I bring this test to people. We do it for research companies, looking at drugs like Crestor, Lipitor, other research. And I had a family event where this would have been really handy to know, and it kind of made me mad that the whole medical system, it's not that way. So I know what I'm seeing here, but I want you to know what you're seeing here. So what I did is I sat down with an artist, and we generated a report, an ultrasound report, to tell you what I find in your arteries. And I don't use what the hospital does. They just look to see how clogged you are. I need to give you a little more nuance. So I'm going to measure the layers of the artery. I'm going to tell you how thick they are compared to other people. So I'll give you a vascular age. You have the arteries of a 90-year-old or a 20-year-old. And I get that from big research studies, is where I pull the data from, to give you that vascular age. And you want your arteries to be younger, definitely. You want it to be thin and flexible. Also on that plaque, plaque has a life cycle. When it's fresh and young, it's gooey, it's runny, it's like a fresh pimple. And over time, the body will vascularize it and make it more fibrous, so it doesn't, a little more safe. Because when it's gooey, if it pops or leaks, the cap comes off that plaque. That is a stroke or heart attack, or at least a thrombus that goes into a blood clot. But if that hits your brain or heart, that's a big event, because that's what it is. This test should be available to you. So I've put it in a nice report. I put the images in the report so you can see it. And if you get tested again, you can compare before and after. I mean, if you work hard, you should see the artery de-inflaming, getting healthier, not red and puffy. You should see the plaque become more secure. It should start soft and gooey, then become mixed, more fibrous, and then eventually it'll become calcified. That's how the body secures it. This is what we'd like to bring to you. We're coming to your area, and we have our ultrasound machines, and we have a nice report, and we can let you talk to a doctor at the end, or whatever you'd like. But you should be forewarned is forearmed. You should know if you have cardiovascular disease. Most people over the age of 40 will have some, and you can work on it. Anyways, thank you very much.